In an era where the midlife crisis has shrunk into quarter-life crisis, the younger generation is going through the pursuit of catharsis a lot earlier in life. We all know what happens when you ask someone, "Are you okay?" They'll either burst into tears or say, "I'm fine." And when someone says, "I'm fine," they are actually not. "I'm fine" means I'm frustrated, I'm upset, I want to quit my job, I want to drop off the school, or simply, "I'm tired." So, why is it that we are so tired? Is it because we are occupied or overburdened with genuine work? Or is it because we spend too much time coping and little to no time doing what makes us feel good? Having high energy levels, staying on feet, staying motivated, and doing your work on time, are these the indicators of a healthy individual? Well, it's time that we deeply understand it. Hi, this is Anuja Mathur, editor-in-chief of Popp Dapp Fashion and Lifestyle magazine. And today on this podcast, we have with us an expert, a certified obesity doctor, author of Self-Care RX, and a self-care professional, Dr. Danielle DonDiego. Through this discussion, we'll try to comprehend the mutuality of diet, weight loss, and mental health. We'll talk about the ways of building career as a doctorpreneur and also how the body image is directly proportional to our self-confidence. Hello, doctor. Welcome to the podcast with Popp Dapp. We are so happy to have you with us today.
Hi, Anuja. Thank you so much for having me today.
Doctor, we are living at a time when our life is getting more rapid and busier as we speak, and one of the most direct outcomes of that juggled up lifestyle and constant mental turmoil is obesity. Experts have said that obesity is not the battle of the belly, rather, it's the battle of the muscle. It's time that we alter the paradigm of self-care and body transformation. It's time that we understand that muscles are not just for an athletic performance and movement. Muscle is for a metabolic sink and gives us an augmented and robust immune system. So to start with this, let's try to understand what exactly is self-care.
I think everyone has their own definition of self-care and what it means and what it is. But my definition of self-care is radically making decisions that are most aligned with your present and future self, regardless of anyone else's influence. For a long time, self-care was promoted as bubble baths and face masks and all these little things. And all those things are amazing. Trust me, I'm a huge skincare fan. So, and I love my bubble baths. But really, all of that is just it's just scratching the surface of the things we really, really need to do. And in my opinion, real, genuine self-care is taking that time to focus on not only finding out who you are outside of what society or people around you have tried to tell you or ingrain who you are, but making sure that every decision you're making, every job you're taking, everything you're creating, every person you are cultivating a relationship with or a friendship with is supporting a present and future version of where you're going, not where you have been. And a lot of times that radical self-care does often mean that we outgrow people and entities of our past, and that can be really, really difficult for us to let go of. But it is a huge part of self-care. You can't continue growing and keep the same things that have held you down in an old version of yourself. You cannot keep them in your life to the same extent if you want to keep pressing forward. So self-care, in my opinion, is very, very radical. It's very, very difficult. It's making those big, difficult decisions, but it's knowing and trusting that those decisions are very much in alignment with who you know you are and where you are trying to go in life. Finding these radical moments and finding the courage to make these big decisions, it does come from starting small. So in my own self-care journey and how my life has evolved over the last many years, it did start with small decisions. It did start with setting boundaries around work and around people. And those boundaries could be very small, and then they grow to become bigger boundaries when necessary. So it's kind of like a muscle that you have to work out and continually flex. So not everyone is in a place to make these radical decisions, but your life will direct you in places where sometimes you're forced to. And if you've been practicing self-care in small ways and really learning how to protect your energy, finding people that are supportive of where you're going and who you are, and surrounding yourself with those kinds of people, it's going to be much easier for you to make those decisions in life, because they're already difficult to begin with. So it's all about flexing that muscle early. And sometimes that is taking time for yourself to have a bubble bath, or, go meditate for 20 minutes, or go take a yoga class or a workout class that you really enjoy that maybe you used to put off for yourself in lieu of doing something for other people. And so those habits we have to learn how to break in small ways, but then we sort of graduate to where these radical decisions in self-care come up in life, and we are able to make those decisions despite the discomfort and the difficulty and life changes that may come with them. So a lot of what I do with my clients is supporting them through making all these types of decisions on this spectrum of self-care to where we are eventually talking about making radical decisions that are going to absolutely change our life for the better.
Wow, this is amazing. So adding on to the discussion itself, what exactly motivated you to start Self-Care RX retreat? And also, if you can just talk a bit about this retreat and what is this all about?
Retreats are absolutely one of my favorite ways to reconnect with myself and to give myself space to figure out what my next steps are. Who's the next version that I'm stepping into of myself? So I personally have been attending retreats. Some of them are healing focused and some of them have been business focused, and a lot of them have intertwined both things together. I don't see them as separate necessarily, but we can definitely get into that. So after seeing the benefit that I have gotten from attending certain retreats, I have felt for so long that the people in my community, in the healthcare community, really would benefit from this. It's so different from a vacation. This is not a vacation. This is a place where you are meeting people who are in a similar situation as you, where you can be vulnerable and you can take time for yourself and have that dedicated space. That's why this Self-Care RX retreat that I've created, this is so much about having dedicated space and putting yourself in a room of supported people and supportive professionals from the healthcare community and those that have succeeded in entrepreneurship, so that you can learn what your next steps are and what your building blocks are to the next version of your life. So a retreat is a great way to do that, because often when we are trying to sit down and think about what it is we want to do with our careers, or what we might want to build and create, we are still in our day-to-day grind, and it's really hard to feel clear when you have a million other things on your mind. And even when you go on vacation, this is why it's very different. You might go on vacation with family or friends, and they're not necessarily people who understand where you're coming from. And it is a good time for you to just completely shut off and have fun, and vacations are totally necessary. But a retreat is a very different intention. Both are necessary, but a retreat is a very different intention. So this is going in with an intention of finding serenity, calmness, clarity, and really tapping into your creative side. In healthcare, we're not really encouraged. It's not really a part of our job to be creative. We can be creative with our treatment plans and in certain ways that support medicine and treating patients. However, we all do have a creative side that, again, it's a muscle that we haven't really flexed because we've been in academia for so long. And so I like people to tap into older versions of themselves and find out who were you? What are the things that you used to enjoy? We all are creative to some extent, and sometimes that can be in creating outlets for yourself. It can be creating creating a business. It can be mentoring others. It can be creating membership programs, or maybe even creating your own retreats. There's so many things that people haven't thought they might be capable of because it's outside the walls of an academic job based on your credentials and what you went to school for. And not everything that we are great at, we understand how to put into practice because it's not something we went to school for to learn how to do and follow this recipe for success, if you will. When you go to medical school, you know that you're going to come out on the other side with a job. You know that you're going to come out on the other side being somewhat successful. You're not always prepared for learning how to figure out what type of practice or life makes you happy because there's such a demand for what we do. So I like people to come in and just find that clarity of what their next steps are and be in good hands. I love supporting people through these big life changes, especially when you might be in a job environment that isn't fully supportive of who you are today.
Awesome. This was so enlightening. So, Danielle, the developed countries are facing such a tough time dealing with the young age obesity due to, let's say, a lot of factors, maybe more than just diet and lifestyle. It has rather become now an amalgamation of factors such as tweaked nutritional content, technology, sedentary educational processes and habits, processed foods, nuclearization of families, etc., etc. But what do you think is the root cause of obesity in the younger generation and how different that is when we reach our mid-30s?
This is such a loaded question. I treat patients medically, so I'm an obesity specialist. So the majority of patients that I see do have obesity or some weight-related issue as an underlying reason for coming to see me in the first place. So there are many medications that are making the headlines lately that do help people to treat obesity and then all of the other comorbidities, such as maybe there's insulin resistance or PCOS, high triglycerides, or even certain liver disease do tend to improve. So, in medical practice as a family doctor, we often were left treating all of the other issues, but the weight management has always been the challenge for the patient. So now we have multiple different medications that can help patients. That being said, what is the root cause? So obesity is so multifactorial. There's not one answer for everyone. And I will again say that it is very much a spectrum depending on who is in front of us. So it can be up to about 70% genetic causes of why someone struggles with obesity. That is something that we have tried very hard to teach others and have the public unlearn that obesity means you lack willpower and just like to eat a lot of food. That's not it at all. And there's still very much a belief out in society that that is the reason. And we know as obesity physicians that that's not the case, and that those that do struggle with obesity are really battling their physiology, their genetics, and they're battling hunger signals that other people who don't struggle with obesity do not understand because they don't have those stronger hunger signals. I like to explain it as these people physiologically have stronger hunger signals than other people. So when they have the same meal as, say, someone who doesn't have obesity, they're not full. They're still hungry. They're not satiated. And that is a physiologic and biologic reason. Now, of course, lifestyle changes matter, but what we do when we treat patients with obesity with these newer medications called GLP-1 medications that battle and quiet this hunger signal, as I like to say, they are able to then adhere to lifestyle changes much easier. Most patients that I have seen, I would say 99% of them have tried every diet, every exercise program. Like, the patients that come to see us have done everything. And if it was truly about willpower and it was truly about just trying harder, they would have won this battle so long ago because they have tried everything. And I have to say, I think they have more willpower than most people because they have withstood diets that are hard. They're hard for anyone. And then also when you're battling your physiology, hunger is miserable. Anytime we are hungry for an extended period of time, it's not comfortable. And it does tend to lead to that yo-yo dieting when we put ourselves into those extreme places. And so recognizing that just because one person is able to eat a meal, feel satiated, and go on with their day, does not say anything about the person next to them, where that may or may not actually be the case, and they are still struggling with feeling starving. So as we get older, we do have changes that make it a little bit harder, but I would say overall that treating the physiologic and biologic component is such a game changer for the patients that we see. They get their lives back. There's so many other benefits that we see when our patients are treated successfully. Their mental health gets better. They feel relief. They feel less pain, less joint pain, less inflammation. Even for women, their menstrual cycles start to regulate, and sometimes having obesity can cause irregularity in your menstrual cycle. So, there's so many things. We also see what's called, Ozempic babies, they call it in the news, where we're seeing patients get pregnant easier because having that excess weight can make it difficult for certain people to get pregnant as well, especially if they do have underlying PCOS, etc. So we're seeing a lot of benefits. There's a ton of studies occurring. There's going to be new medications coming out in the coming years. So this field is only growing, and it's so necessary. Almost half of our population is going to be qualified to potentially seek weight management. And so we need competent medical doctors that can treat patients while also not projecting any bias onto the patient. And also we need access to care, and we need affordability of these medications. So there's a lot of challenges ahead of us with obesity medicine. But we're up for it, and we're here. And that's why those of us who have decided to specialize in obesity medicine are so passionate, because it's so rewarding for us to see patients do so well and for them to just be so happy and feel better. All we want as doctors is for our patients to feel better. And that's very often not something we can always accomplish. And so helping people treat obesity, treat their weight, and treat their comorbidities, it's an extremely rewarding part of medicine. So I'm happy to be a part of it.
That is seriously unbelievable. So, Dr. Physical fitness is the perfect blend of dietary habits and a regular physical activity. I think that's what we have learned with our researches and studies, and it makes absolute sense also. But what are the other factors involved in weight loss and transformation journey?
So yeah, physical fitness and balanced dietary habits, they're necessary as a part of a weight loss transformation, no matter where you're starting. So, kind of like I said before, if you do decide to use a medication to help you on your journey, it can make certain parts like the dietary habits more manageable. But it's not just about eating less. It's also, what are the nutrients, the macro and micronutrients? What are you putting into your body that, is going to help you function as a human? So it's almost easier to focus on those things when you're not dealing with this term that has been coined food noise, which is the obsessive thoughts about food that is outside of a normal pattern of hunger. And it's not satiated with with eating food as well, or eating a meal. It's like a constant obsessive thought about food. And so a lot of our patients do describe this. So they want to focus on balanced dietary habits, but it's so hard, right? When you're trying to battle your physiology that is just not allowing it to happen. So the patients we see, they have access to registered dietitians. And I think if that's available to someone, it's such a great asset to care, because they can sit and not just give you a generic meal plan. We're so beyond the days of generic meal plans. There's no one size fits all. They get to sit and meet with you about what are you currently intaking and how can we tweak that or optimize that so that you feel good. And also, are we getting enough food in? Are we getting enough calories in? Are we getting enough fiber? Are we getting enough protein? It becomes instead of what can we subtract, like how can we add all the good things while you are utilizing these weight management medication. As far as physical fitness, so I was a personal trainer for a long time, many, many years, before medical school, during medical school, and a little bit into residency. I still did train some people throughout residency. And I also competed in bodybuilding shows as well, in the bikini division. So that was something I did for a while. And so physical fitness is definitely in my background. And if I were going to say the most important thing about physical fitness is, one, make sure that it is something you enjoy. Physical fitness is not about punishing yourself for what you ate that day or the day before. It is not about making sure you can burn as many calories and track those calories so that you can burn off everything you ate, or a certain amount that you ate. These are things that I think the diet world wanted people to focus on, and it was reinforcing that idea of, that you're in control of this. And as I alluded to before, a lot of our patients, it's not so much in their control when they're fighting their physiology with hunger and obesity. So I like patients to pick types of physical fitness that they enjoy, that they're also comfortable doing. A lot of my patients are not super comfortable going to the gym yet. There's been a lot of shame for them around entering a gym and comments from people. But at the same time, some people really, really enjoy it. So it doesn't have to be a gym. It can be home workouts. It can be going for walks. As long as you're doing something that you enjoy, I think that's the most important part. If you want to get a little more specific, making sure you are incorporating resistance training would be my biggest recommendation as far as type of physical fitness. Now, that can mean weightlifting. Does that mean that all resistance training is weightlifting? No. So you can find other ways to have resistance training incorporated into your fitness journey, but it's going to make a big difference in body composition, which is going to then help you over time with nutrition and overall body composition, body fat percentage, etc. And that tends to be when we see patients start to really stop looking so much at the scale and looking at other markers, such as maybe how their clothes are fitting, or maybe if they're tracking inches lost. We do see those things improve the more that physical fitness and physical activity is incorporated, especially if it is some type of resistance training. But it has to be fun, and it should not be punishment. If you are doing something you hate, that you are miserable doing, but you have convinced yourself that is the way to be physically fit, unless you enjoy that type of physical fitness, it's not necessary. We don't have to recreate the wheel. We don't have to do anything extreme. We just need to be active, and we need to do it on a regular basis.
Wonderful. There was something that I wanted to discuss with you, which actually intrigued me a lot, is the term doctorpreneur. It's true that advocating self-care and making a career out of it are two poles apart things. So I would want you to talk a bit about the do's and don'ts of becoming a doctorpreneur.
I love this question. Some of the major do's, I would say, is be brave. know that you are not only qualified, you are probably overqualified to do whatever it is in your brain. You do not usually need another degree. I often see people want to start a business, and so the first thing they do is look at business school or business programs that they're going to take, in the academic sense. And if you're trying to go into the corporate world, that might be something that's necessary for you. However, it is not necessary for every case to just learn business practices. So one of my big don'ts is don't feel that taking the time and putting the energy and maybe more tuition into getting another degree is definitely going to help you, because it's so much more than that. And I think that a lot of times when we've been in academia for so long and we look at credentials as, markers of success and markers of credibility, which they are, at the same time, sometimes we can put off taking real action into our next steps by saying, oh, well, I'm going to go get another degree or a master's degree here. But really, we are just prolonging the things that we want to do. And just for reference, so I have a master's in business administration, and I actually did a 5-year medical degree and MBA program together. So I came out after 5 years with both degrees and spent time in both scenarios. And I wasn't really sure what I was going to do with it. My ideas back then were definitely different from where they are now. It's kind of the beauty of allowing yourself to evolve. But having gone to business school, there were a lot of things that were super beneficial. And I think in the right setting, it's something that certain people might consider. But for what I teach and the clients that I work with and the ideas that they have, they don't need to go get another degree at this time. They need to trust themselves. They need to value their ideas and value their worth. And so much of the things in common of the clients that I work with is really on the basis of empowerment and helping people to realize their own self-value. So you don't necessarily need another degree. You just really have to believe in yourself. And that's so much easier said than done, especially when you've been in the world of medical training that, demands perfection of you at all times. And so sometimes, we hear the word imposter syndrome. I think a lot more people in healthcare do struggle with imposter syndrome. And I would bet that it's more women as well. And so you feel like you need more credentials to show the world that you are valuable in their eyes. But in reality, you just need to believe in yourself and realize that you're so much more qualified than you think. So do believe in yourself. Do be brave. Don't feel like another certification or degree is going to just automatically shoot you to the top of success. I find that it's just not as necessary. And so I help people find those building blocks and take those steps in a way that saves them time, saves them energy. And my hope is that they start making business decisions and life decisions from a place of alignment with who they are, not what they feel society needs of them to prove that they are worthy in whatever space they are trying to enter.
Wow, brilliant. So something that the pandemic and the turbulent economy has taught us is never keep all your eggs in one basket, or simply to have multiple sources of income, because it is highly unpredictable that what would work right now won't work in the future. So please, if you could just talk about that.
Yeah, so having multiple streams of income as a healthcare professional is very important. And this topic, it can be a little bit controversial because doctors inherently do have high paying jobs. However, what I have found, one, is that those high paying jobs are burning us out. and we often don't know what else we can do or how do we get a break unless we work less. And sometimes working less is not really an option. So the way that I see multiple streams of income, it's setting yourself up for your present and your future to where if you need a real break, or you want to be more in control of how much time you are giving to the healthcare space and keeping in check with your own mental and physical health and, spending time with your family, all these things that are very, very important, that I don't think the healthcare system in general allows us to have. We are very much guilted into working more, and that we are, we kind of sacrifice ourselves and our time for others. And usually we're happy to do it, but at some point there's lack of balance for most of us. So having those multiple streams of income, I think, lifts the burden and the pressure of being in a career where so many of your decisions are life-changing and sometimes life-saving for the client or patient in front of you. Patients are not clients, but just for an analogy there, we are making decisions, hard decisions and complex decisions every single day. And I know for me, I at some point was like, I would love to do something that is additionally not as complex all the time. And, I think that I know for myself, I felt a little bit of shame for feeling that way for a while, because it, as in medicine, you don't want to be perceived as weak or not being able to cut it, which are a lot of those ingrained ideas that they place on you, that the system places on you if you do say things like that out loud. But for me, I was like, I do desire to live a more flexible life. And the way that I was personally working in the past, that was not possible. That was never going to happen. And so for myself, by creating other streams of income, and it's not just about creating the streams of income. For me, it's doing things that I also still enjoy. I do enjoy medicine. I do enjoy healthcare. I just didn't want to do it 80 hours a week for the rest of my life. I don't think that is living. And I desire to still live my life and not sacrifice every minute of my time to my career. I had a mentor in medical school that told me at one time, and I was trying to decide what field I was going to go into. I hadn't yet made a decision. And they very much told me that, when you're in your 20s and you have all this energy and you don't have a family yet and all these things, like, you are just so focused on your career, you can't really see the future, that at some point you're not going to want to be living that type of lifestyle forever. And that's how a lot of people do end up resenting their careers, because they are so tied to it. It's a little bit of a love-hate situation. And I really took in that advice. I was like, I can't totally see it, but I trust that what they're telling me is very real, and I don't want to put myself in a place where I have bottlenecked my options, and be all in on a career that demands everything of me. So it was one of the reasons why I chose to go into general practice, actually, because I looked at going into family medicine and general medicine. One, I really liked the type of work that I was learning how to do. So I knew that I was going to enjoy the work itself. But two, being in a general field of medicine really gave me the opportunity to branch out into a lot of different areas. And I wasn't bottlenecking myself in a way that I was ultra specialized or had skills that were not transferable to other places. So my decision for my medical field was strategic in a lot of ways, but also was very much in alignment with the type of medicine that I really care about. And so it was, again, that's why I talk about alignment. It can be mutually beneficial. There can be more reasons than just being a, sacrificial healthcare worker to choosing how you want to pursue your career. And that has been so true for me since I've decided to go into that field. I've been able to do so many things that I don't know that I would have had as much opportunity. I don't want to say that definitely because you never know. I think I would have found a way, to be honest. But it's given me a lot of ability to branch out and be creative and work as much or as little as I want in healthcare, and that's exactly what I desire.
Great. So, Doctor, we are living in a time where body positivity and self-acceptance is a thing right now. Where do you think we need to draw a line that separates healthy weight and obesity?
This topic of body positivity and self-acceptance, and also medically treating obesity as a disease, it's a very hot topic, and it's very emotional for a lot of those that are in the space where they have been struggling with obesity and trying to be body positive as well. So my personal belief is that they absolutely can coexist. But it also it takes a lot of mindset focusing. I don't think that to be body positive, you have to be a certain weight or a certain body type at all. I think you can be body positive at any size. I think you can love your body at any size. Each person has a personal journey with learning how to love themselves, whether it's your physical body, your mental and emotional body. Everything is interconnected. That's the way that I see it. And so body positivity is important. It's important no matter what your weight is on the scale. And so it's very nuanced, this conversation, because also let me just also say, the way that I practice obesity medicine is I have very much adopted the perspective that I will never look at a patient and say, you need to lose weight. That is something that has happened over and over and over again in healthcare. And although there might be like some truth to it from a medical perspective that yes, things will get better, the problem has come with that, like I said earlier, patients have done and tried everything, and they have not been able to be successful because they've been fighting their biology this whole time. So I always wait till a patient is ready and they want to come to me and they're in a place where they would like to look into weight management medically, and then I would have that discussion with them. There's very much a phase of readiness that has to be there for someone to enter those conversations. And so I always, and if anyone out there is listening that's in the healthcare field, or even just have friends or family members that are maybe struggling with obesity, don't give unsolicited opinions or advice. No one who struggles with obesity doesn't know that, hasn't been told at some point that they need to do something, and that's been so defeating for people to hear about themselves. So it's a delicate conversation, but I absolutely believe that body positivity can coexist. I think we should love our bodies at every size, at every phase. I like to look at our bodies as how much they do for us, and that it's not just an object of attraction. Especially as women, our bodies can create humans and birth humans. And, we can do all these physical activities that are amazing. Our brains get us through crazy challenges and allow us to be high functioning adults. And, I like to reframe and refocus of like, let's try not to look at what our body isn't, but like what is it in fact? What does it provide us? What is it doing for us every single day that we don't necessarily acknowledge? And reframing that mindset can really, really help people to love their bodies in a deeper way and value everything that it gives us, and respect our bodies, that, it's so much more than an object for other people to view and judge. And that's so much easier said than done, as so many things that I've said here today. But, I want people to feel healthy and happy. And if weight management is something that someone is deciding, I want them to decide it from a place that it's aligned with who they are at this moment, and have a conversation with a medical professional that is non-judgmental and not projecting any bias on them, and can provide them long-term compassionate care.
That's incredible. Now, this is something that I would want you to throw some light on, is a delusional perfect day. This is something that you have talked about in your videos as well, and which was so interesting to listen to. So I would love you to elaborate about a delusional perfect day. What is that exactly?
So let me tell you about how this came about. I remember I was a travel hospitalist for several years, and I would go to these rural hospitals and stay overnight for 7 to sometimes up to 10 days at a time, and actually be living not at home during this time. And then when my time there was done, I would, drive home, and I would have, so many days off. And so I did that for a while when I was in transition. And so I started diving into the entrepreneurial space and listening to podcasts, and I just started getting attracted to people that were running businesses and seeing how they were doing it. And I was kind of like, oh, that's interesting. I've never thought of that. How are these people doing this? And there was an activity that one of these famous entrepreneurs had put out about, what would your perfect day look like if you could not insert, oh, but I have this, oh, but I have that. Like all the things that instantly come to mind of why you can't have that perfect day. Like, what if you just allowed yourself to daydream? And what does that perfect day look like? And so I was sitting there, and I had a less busy day, and I was sitting in my office, and I was like, let me just write this out. And I was like, perfect day. And I was kind of laughing doing this because this doesn't exist in healthcare. So I was really letting myself daydream here, and I was like, oh, I would love to wake up at 8 a.m. and make a cup of coffee and cuddle with my dog, and not be rushing out the door, spilling coffee in my car everywhere, trying to make it to work on time. I was like, I really would love to have slow mornings, and then maybe I'll start work at 10 a.m. and, see a few patients. And then, yes, I would have time for lunch. I wouldn't be force feeding myself in between patients. I was like, I would love to sit and have lunch, and then maybe start to see patients again around 2 o'clock. I mean, I let myself completely daydream. And then I was like, I'd love to come home and have dinner, go work out. And then I remember writing that, I wanted my weekends to not include work, because at that time that was not really existent. It felt like I was working 7 days a week. So I let myself kind of daydream. And then I started kind of diving into the world of manifestation. And I was like, what would this feel like? What would this feel like if I let myself have this life or desire this life? And all of a sudden, not all of a sudden like that day, but things started showing up in life. Opportunities started showing up in life. Telehealth was not popular back then, and a telehealth company contacted me where they were starting a new company, and it was going to provide flexibility, and you can work from home, work from anywhere, from your laptop. And I was like, this sounds too good to be true, but I'm going to do it. I'm going to try it. And I just started letting myself say yes to things as doors opened that were very non-traditional in medicine. And so I don't think I would have really allowed myself to say yes to some of these opportunities had I not envisioned a life where there was this perfect day that was even possible. If I couldn't envision it, then it didn't exist. And having been an athlete previously as well, visualization is a really powerful tool. And so, let's say you're playing basketball. I used to play basketball. You would envision yourself making the goal. You would envision yourself playing awesome defense. Whatever the thing was, you would sit and envision it. And it helps you really focus in on that goal and what you want to accomplish. And so this was a new way for me to visualize life. And so I do this with a lot of my clients because they're in a place where it sounds so impossible, but it's always impossible if you don't know what it is that you want to work towards. So you have to start putting things down on paper. You have to start allowing yourself that these things are somewhat possible. And I can say that for the most part, I'm living my perfect day and have been for several years. And that did not happen overnight, but it did allow me to say yes to opportunities that other people in my career at the time told me were probably not good ideas because they were not traditional paths in medicine and they were not guaranteed, security in career. And I was like, I don't know if I care so much about security in career. I was like, I'm more interested in just trying something new and seeing if it works. And so the Delusional Perfect Day was a launch pad. It was a massive launch pad. And I laugh now because I was laughing then at how ridiculous this looked to me on paper the day that I did this for myself. And now here we are 6 years later, and I'm living my perfect day. I have my slow mornings. I work at home. I can work from anywhere in the country with my laptop. And, I make my own schedule. And those are things that they're just non-existent in healthcare. So I'm living my dream right now. And it's all because of that one day when I put this down on paper and made it happen.
Wow, perfect. Nice to know that. There is one very crucial aspect of life that experience maybe teaches us is the fact that everything in our body and its processes is interconnected. And we believe it or not, one dysfunctional part or a process and the whole health is getting affected. We cannot physically be fit and mentally be at a toss and vice versa. How important do you feel our mental health is in achieving any body transformation or a body positivity goal?
Anytime someone is attempting a body transformation or going on a journey of body positivity or both at the same time, mental health is probably one of the most under talked about components throughout this entire process. There's been so much focus, I think, in society on the physical. And so the patients that I see, they are so focused on the physical, but it has deteriorated so many parts of mental health for them. One, because they have not been able to find success in all the things that they've tried, which can be very defeating and make you feel very down on yourself. But two, one of the most surprising things that I have found in practice is when I see patients initially on their initial intakes with me, I would dare to say that the majority of them, when asked about their weight journey and, how they have viewed, everything they've tried and when things got hard or have they always been hard, whenever they're asked questions like that, so often there is something in there about some traumatic event that really just caused the situation to spiral. And I mean, not everybody, but this is very, very common from my perspective in practice. Maybe they always struggled with obesity, and then there was a death in the family, or a breakup, or a divorce, or maybe there was some abuse happening. Something happened, and then it just overtook them to a place where, the weight tended to spiral. So this is what I see from a lot of my patients. And when we do focus on the physical part, a lot of physical things get better. And sometimes, yes, mental health does get better because they're finally feeling this relief. Now, what I have found is that amidst the relief of feeling hungry and feeling food noise all the time, things that clouded thoughts and their time and everything that they thought about all day, there is now space. There is space for them to think about other things that are good, but sometimes there is space for traumatic situations and maybe underlying mental health issues that were suppressed to also resurface. And sometimes also we will see, we have to be careful to watch for any like eating disorder behavior, that comes up as well. And so it's very important, in my opinion, for patients to also have a counselor or therapist or somebody of support through their journey that is focusing on mental health. The access to mental health is obviously a huge issue in this country for everyone. And on top of that, most patients in the past were sent to therapists and counselors so that they could learn to eat better. And that's not the goal here. The goal here is to actually send patients to therapy and counseling if they need it. That's a decision you make with your doctor. And so that they can address things that were always suppressed and kind of hiding that are resurfacing, so that we can tackle mental health while we're also tackling physical health, because they are not separate, in my opinion. Everything is connected. Everything affects the other piece, emotions, mental, and physical. And so missing this piece is missing a big part of the body transformation journey, and not supporting a patient in finding that body positivity and finding self-love. It's not supporting them in that if we're not also, offering this component. And does it always have to be with a therapist? Not necessarily. I know different things work for different people, but there should be some intention in this area from the patient's perspective. They should be doing something, in my opinion, that is supporting their mental health. And if they're doing that, I tend to find that they do a little bit better over time, and they tend to not stress as much maybe when there's plateaus in weight, because we want the scale to not mean something about you as a human. And so often this is what is tied together, and we want to break that cycle so we can, quote unquote, fix the physical part of it biologically with medication if necessary, and support of fitness professionals and dietitians. But how are we also then breaking that connection from the mental and emotional component if we're not addressing that piece either? Losing weight, and I've heard it time and time again, is losing weight doesn't necessarily help everyone's mental health from the perspective of how they feel about their bodies overall. They might feel better in clothing, they've noticed all these other physical benefits, but we have to check in that the mental component is following that. And if it's not, then it needs to be addressed. So I think mental health is a huge component. I'm a big advocate for mental health in general, whether someone is on a body transformation journey or not. I'm very open that I've been on a mental health journey for a long time for myself. And so a lot of times when I do speak about this to others, I'm coming from a place of not just a medical professional who can tell you need XYZ, but someone who has done a lot of deep inner work and hard work in facing parts of myself that were not pretty and facing them head on, not shying away from them, and doing so in the right setting with a therapist. And I think that is hands down one of the biggest reasons why I have been able to come to this place today and, full circle, give it back to others and help others find their own journey and find their own path. Even whether it's in business or everything else we've talked about here. So yeah, it's very important. And if you feel you need it, I encourage everyone to just seek out something that they feel will help their mental health.
Amazing. And something on the similar note, doctor, how connected is our body image to our self-confidence?
This is a complex question, actually. I fully believe that you can have self-confidence at any size. I do fully believe that. And I want to share a little bit about my own self-confidence and body image journey. And it's from a different perspective of things we've already spoken about in the obesity world. But, I said I was in the bodybuilding space and a personal trainer for a while. And I thought for a long time that having like a really fit body meant that I was confident. And I can look back now that I'm not in that space anymore, and say I don't really know how confident I was, but I didn't know that at the time. It's only retrospectively that I can look back and say I wasn't really that confident, because I was always striving to change something. I was always striving for perfection, but the line kept moving. Perfection wasn't really a real destination, so you keep moving the bar and keep chasing something. And I was definitely stuck in that cycle for a long time. And I think from the outside world, people probably thought I had a lot of it together. I was very fit. I was eating clean, as they say, and on meal plans, and I had trainers and all that kind of stuff. But I don't know how confident I really was. Now, the last almost 2 years, I have taken up a new hobby. And I love posting about it, and I love talking about it. I'm not an expert by any means, but I embarked on a pole dancing journey. I've always wanted to try it. I was looking at women who were really good at this, and just they exuded confidence, in my opinion. And I was like, wow, I just want to learn how to do this stuff. And I found no matter what my body looked like, how uncomfortable and how not confident I actually was in my own skin. When I first started, I was almost like paralyzed by how I felt about myself in that space. And at the place I go, everyone is like so supportive, and I love it so much. But inside, I was really struggling, and I still do struggle. I am not saying that this is a journey that has been won at this point, but it has definitely progressed, and I've definitely done a 180. And so I've learned through movement and music and community and being in a room with women of all sizes who are really putting themselves in a safe space to be more comfortable with their bodies and have fun. I have learned confidence in a way that having a really fit body didn't provide me. It's a very different experience, and I did not realize how not confident I was until I started my pole dancing journey. And I've come a long, long way, but I would challenge anyone who is obsessed with like looking at their body in the mirror and making that mean something about themselves, no matter what size you are, and kind of obsessing about different, areas of your body you want to improve and this and that. If you were ever in that mindset, I challenge you to do something that involves movement, involves honoring your body and its abilities, and feeling feminine and feeling sexy and just letting loose, like no mirrors, no nothing, like just having fun, putting on some amazing music and just like having a blast with people around you, and also putting yourself in a supportive environment that isn't critiquing you. And also it helps you to not critique yourself. So coming from the bodybuilding space, I was so used to sending progress photos and getting critiques back. And that's part of it, right? It's not blaming anyone for any of this. I willingly entered into that space, but it does kind of mess with your mind a little bit that like you're always looking in the mirror. You're always like posing a little different. You're always trying to say, oh, I need to work on this area or that area. And now with pole dancing, when I think, oh, I need to work on this, it's like, oh, I need to work on this really cool move. And, I get to like watch myself back and how much progress I've made. And that gives me so much confidence, and I'm so happy with myself, and I'm having fun doing it. So body image and self-confidence, they're related, definitely, but they're very, very different things, in my opinion. And don't get confused with like body image and physique meaning something about your confidence, because for me, it has actually been inversely related. And I'm fit in a different way today. It's not as visible as it was when I was in the more personal training space, but I am so happy, and I'm so excited for what I've trained my body to do in those spaces with pole dancing, and it's just a lot of fun.
Wow, that's awe-inspiring. So, doctor, what's cooking for the future, and what are your plans now?
So many things. I've been thinking about my second book for a while, and so that's kind of in like a brainstorming phase. When it comes to books, you just never know like what's gonna come out, when things are gonna come to fruition. So that's something that is in the future, but I can't say how far in the future, but it's there. My brain is already manifesting this. And otherwise, we have our self-care prescription self-care RX retreat coming up in 2 weeks for this year. We're going to be planning yet another retreat for the fall for healthcare professionals that is going to be more healing centered, less business, more just connection, community, more just being with each other and letting yourself decompress in a healthy way. And, my mentorship company has been thriving this year, and I'm always open to new clients. We've created a mastermind for a group setting for doctors and healthcare professionals that are, have started in their business and are looking to progress and find other people. Like I said, it's all about community. It's all about putting yourself in a room of supportive people. And so those are the experiences that I am passionate about creating, because in healthcare, we so easily feel so alone in our stress and our thoughts, and like a lot of people around us don't understand. And those that do, those that are other healthcare professionals, we don't want to burden them because we know that they are feeling the same way. So it's a very lonely mental space. And so I'm very passionate in creating situations, whether it's virtual or in person at retreats and events, where we can find community, find connection and common ground, and make sure that we are keeping ourselves in check and putting ourselves in a place to make those radical self-care decisions that are in alignment with who we are presently today and who we want to be in the future, where we are going, so that we are not held back by guilt from what other people think we should be doing. We want to make sure that we are living the life that we want to live. And if we have evolved and that has changed, then I'm providing the space for you to experience that change and that evolution and help you foster your ideas and your creativity and put it into action. So future plans, mentorship is always going to be a part of my world, and retreats. We need more connection in healthcare, so that is where I will be.
Great. It was lovely to have you with us today, and this discussion has been so interesting, so inspiring for me as well.
Thank you, Anuja, so much for having me today. I have so enjoyed this conversation. I look forward to chatting with you in the future, and thank you for having me on your platform today.
Thank you so much for coming to the show. Thank you.